All right, of course, we're talking all things ANC policy this morning with its policy conference kicking off from today and throughout the weekend. We want to focus on the issues of health that have been outlined in the policy documents for the 2022 conference. Government saying that it's made inroads in providing equal and quality health care in the country. On the issue of the national health insurance and health financing, it says progress is being made in the lawmaking towards the NHI Act, the COVID-19 pandemic, resulting in an 18-month delay in the processing of the bill. So let's talk all things healthcare and the NHI bill. Bring in Wits School of Governance, Professor Alex van den Heever, who joins us via our video link this morning. Prof, it's great to have you with us on the program. And I've got the section from the policy documents that outlines issues around NHI. It also talks about issues in the healthcare system. So before we get to the issue of the NHI, Prof, can we talk about the kind of struggles that we're facing in the healthcare system of late? Gauteng Health in particular has been in the headlines over the past months, years, for all the wrong reasons.
Gauteng Health and quite a few of the other provinces are in what can be called a sort of perpetual state of crisis. And in a perpetual state of crisis. And I think that this is largely due to what is essentially entrenched corruption within many of the provinces. Apologies, I'm just hearing background voices coming through.
I'm sorry. Thanks for flagging that, Prof. Let's get that sorted out, get the background noise out of your ear, and you can continue, Prof.
Okay. And I see none of those issues addressed in the paper. So, for instance, the failure to repair the Joburg Hospital, the Tembisa crisis, the issue that Tembisa was overspending money, the murder of a whistleblower, dealing with that, the attempts to silence whistleblowers, dealing with who are pointing out failures within their hospital and dangers to patients, are all parts of a systemic problem that need to be addressed through a change in the governance structure. And this is not on the agenda at all. Governance at the provincial level of government, provincial health system needs to be fundamentally changed. And that is a priority. And it has been part of recommendations made by many health professionals who've made that public, about 1,500 who've written basically to the Minister of Health to deal with this situation going forward. But there is no action today.
I mean, Professor van den Heever, can we talk about an NHI before we've dealt with the kinds of issues that we face in our healthcare system?
Well, the problem is that the NHI proposals themselves are a distraction from real reforms that are required, because it completely ignores all of these issues. So you can't really talk about introducing doing other things in order to introduce NHI. What we really require is that people focus on reforming the health system to improve what it provides to people. So this is actually where the priority lies. The National Health Insurance proposals propose to centralize.
Sorry, Prof. I see you're still struggling with issues of sound. If I can what are you hearing exactly?
It's voices coming through as if a microphone is open.
All right. If I can speak to our sound team while I'm on air here. Control, please, can we sort out the issues of sound feeding through to Professor Alex van den Heever so that he can focus on what we need to discuss here. Prof, I'm hoping that while I'm talking, that issue is being sorted out. And that you can get back to focusing on what you wanted to say. Continue, please.
So the National Health Insurance proposals have nothing to do with addressing the systemic weaknesses within the provinces. It centralizes key decisions and functions at the national level of government. And these are not the problems. That's not the problem that's causing what we see today in the failure of the Provincial Health Service. Part of the failure that we see coming through is that individuals who are, for instance, who are clearly implicated in corruption are never followed through. We've seen at the national level of the department people who have been involved in the digital vibes corruption are given a slap on the wrist instead of being dismissed and charged. We see people who are perpetually out in the, who are perpetually sort of free to operate, despite the fact that they are implicated in these issues, like William Kiese, the former Minister of Health.
Yeah.
So these are instances where it demonstrates there is no accountability within the system for senior officials and ministers and MECs who are essentially stealing from the state. No accountability for them. And under those circumstances, it is impossible for a health system to function because the rot starts and is maintained from the top. And what we're seeing is that they're effectively being protected. And that can't happen in a well-functioning health system. That's where the source of the problem is. It's not going to be solved by NHI. It's going to be exacerbated by the proposals.
Well, you talked about in the start of our interview the murder of Babita Deokaran. That News 24 expose this week uncovering what Deokaran had been looking into in just weeks, days before a death, which was corruption at Tembisa Hospital. WhatsApp messages that have emerged between Deokaran and Lerato Madio, who's the CFO in the Department of Health in Gauteng. In fact, we've also tried to reach out to the CFO, to the Department of Health in the province, to the National Department of Health. We were sent, as Newzroom Afrika, from pillar to post. We've been unable to get any kind of comment on what the way forward is insofar as addressing this kind of issue is concerned. We've gotten nowhere. It's a sign of what you've talked about, isn't it? The issue of a lack of real accountability.
Yes, what's happening in relation to Deokaran and other instances, but it's so stark in relation to that, is it's not normal. There is substantial evidence, prima facie evidence of criminal conduct and within the province. And who is responsible? Where is the investigation? Where are the officials responsible? That is very, very unusual because, firstly, just in terms of the Public Finance Management Act, what has happened at Tembisa Hospital should be pursued and everybody responsible dismissed and charged. Because in terms of the Public Finance Management Act, there's misconduct. That's aside from the issue that a whistleblower who had identified the obvious improper conduct, the obvious, blatant improper conduct, is murdered within 2 weeks of identifying that issue and attempting to stop the payments. The fact that there's no follow-up, absolutely no follow-up in the provinces is absolutely scandalous and just shows the state of corruption within the provincial health departments.
Certainly. And there's no talk of the kind of corruption, particularly in health, in the document that I have in front of me here from the ANC's policy conference, which kicks off today. Professor, let me thank you for your time this morning. Alex van den Heever is with the Wits School of Government as we continue to unpack the policy documents of the African National Congress. This time we were talking about the NHI and the state of health care.